Welcome back to What the Study Says. Hey, if you've ever winced going up a flight of stairs, or maybe you felt that little twinge after a run, or you just stood up and your knee made a sound you've never heard before, then you are in the right place. We are tackling the super frustrating topic of knee pain. But we're not just throwing opinions around. We are diving deep into a huge review from one of the most respected medical journals on the planet, JAMA, to find out what the science actually says. So, just how big of a deal is knee pain, really? Well, get this. According to the study, a whopping 5% of all visits to a general doctor's office are for knee pain. Yeah, you heard me right. Not 5% of visits to a bone specialist, 5% of all of them. This isn't just a minor annoyance, it's a massive collective problem. Okay, so with that many people hurting, the million-dollar question is, what is going on in there? Who are the main culprits behind all this aching and clicking? Well, the study helps us zero in on the three most common causes. You can think of them as the usual suspects in the great knee pain mystery. And here they are, the big three. First, osteoarthritis, or just OA for short. Then there's patellofemoral pain, which you've probably heard called runner's knee. And finally, the one that sends a shiver down everyone's spine, meniscal tears. We're going to break down each one, bust some really common myths, and show you what the actual evidence says is the best way to deal with them. All right, first up to the plate is osteoarthritis. Now, the story we've all been told is that it's just wear and tear, right? Like your knee joints are just a set of brake pads that eventually wear out from use. But what if I told you that's not really the whole story? Not even close. But before we get into that, let's just try to wrap our heads around the scale of this. The study estimates that 654 million adults over 40 have knee OA worldwide. That is an absolutely staggering number. We're talking about an incredibly common part of the human experience. So here's the big myth bust. OA isn't just your cartilage wearing down. The JAMA review makes it crystal clear. It's a disorder of the entire joint. That means the bone itself, the ligaments holding it together, the muscles that move it, the whole system is involved. It's a complex biological process, not just a simple mechanical problem. And here's something else that might surprise you. A lot of us think you have to get an X-ray to know if you have osteoarthritis. But the official guidelines say that for most people over 45 with the classic symptoms, pain that gets worse with activity, it's a clinical diagnosis. That means a doctor can figure it out just by talking to you and doing a physical exam. No routine X-ray needed. So what do you do about it? What actually works? Well, this table says it all. The top-of-the-line, first-choice treatments aren't things that are done to you, like shots or surgery. They are things you do. We're talking about exercise therapy, managing your weight, and simply learning about your condition. This is a huge theme, so keep it in mind. The best first step is an active one. Okay, let's move on to suspect number 2, patellofemoral pain, or PFP. If osteoarthritis is kind of the classic issue for the over 40 crowd, PFP is its younger, more athletic cousin. It's that nagging, annoying pain right at the front of your knee that just won't seem to go away. And man, is it common. The study points out that about 25% of people will deal with this at some point in their lives. 1 in 4 of us. It's especially common if you're an active teenager or young adult. So if you've had it, you are definitely not alone. So how do you get rid of it? You might be expecting some complicated, high-tech answer, but the best evidence actually points to some surprisingly simple stuff. It's all about strengthening the muscles around your hip and your knee. Yeah, you heard me, your hip. And sometimes things like supportive insoles for your shoes or specific taping techniques can help too. Now, this is a really, really important point, so listen up. For this kind of knee pain, PFP, the science is overwhelming. Surgery is generally not the answer. The real solution is all about building a stronger support system for your knee, starting with your own muscles. All right, time for the one that really gets people worried, the meniscal tear. The common thinking is pretty simple, right? It's torn, so a surgeon needs to go in there and fix it. But what this JAMA review found? Well, it might just flip everything you thought you knew about meniscal tears completely upside down. So first things first, we have to get one thing straight. Not all tears are the same, not by a long shot. The study draws a super important line in the sand. You've got traumatic tears, the kind you get from a sudden twisting injury, usually when you're younger. And then you have degenerative tears, which are way more common in adults over 40 and often show up with no specific injury at all. Okay, now, prepare to have your mind blown. This is one of the most incredible findings. Research shows that nearly 20%, that's almost 1 out of every 5 adults over 40, has a meniscal tear that you can see on an MRI, but they have zero pain, no symptoms at all. It just makes you wonder, right? If your knee hurts and an MRI shows a tear, is the tear really the thing causing the pain? So let's take it a step further. When you put the two main treatments for these super common degenerative tears head to head, the results are just, wow. Exercise therapy is recommended as the first-line treatment. It works. Surgery, on the other hand, it gives minimal, if any, benefit over just doing the exercises, and it comes with a bunch of risks. And here it is. This is the knockout punch, the single most powerful finding in the entire review. For those common degenerative meniscal tears, the science shows that one of the most common orthopedic surgeries in the world provides no more benefit than a placebo surgery. That's right, a fake operation worked just as well. Let that sink in for a second.
So we've just looked at 3 totally different knee problems, right? OA, PFP, and meniscal tears. They affect different people in different ways. They seem totally unrelated. But what's so amazing is that this study reveals the simple, powerful idea that connects all of them, a sort of grand unifying theory of knee pain.
That's it. That's the secret. Despite the different names, despite the different details you see on an X-ray or MRI, the science is pointing us to the exact same starting line. For all 3 of these incredibly common conditions, the best evidence-backed first step is exactly the same. And here it is, the recipe for success. It boils down to 3 simple steps. Number 1, get educated. You have to understand what's actually happening in your body and what your real options are. Number 2, get moving. Start a smart, targeted exercise program. And number 3, get in control. Learn the strategies to manage your own condition. So look, if you remember only one thing from this entire explainer, please let it be this. The science is screaming at us that for the huge majority of common knee problems, the best, most effective first treatment isn't a pill, an injection, or a scalpel. It's you. And this chart just lays it all out. These 3 things, exercise, education, and self-management, are the pillars of modern, effective knee care. It's a huge shift from just treating a picture from an MRI scan to empowering a person to take control of their own health. And hey, don't just take my word for it. This is a direct quote from the conclusion of that massive review in JAMA. It literally could not be any clearer. The first and the best thing you can do is conservative care, led by you. So what do you do with this information? Well, it's a tool. It gives you the power to ask your doctor better questions, to make sure you try these powerful conservative options first, and to take an active role in feeling better. For so many of us, the science says the power to fix that achy, breaky knee is already inside you. Thanks for watching. If you found this helpful, do us a favor and subscribe and share what the study says. We'll see you on the next one.